On the vaccine, and I'd just like to hear this, that's coming out. You know, like we get the flu shot every year. So every year there's a new strain, so you get a new flu shot. So when the COVID vaccine comes out, is this going to be like, I just need it to get it once, and once I get the COVID vaccine, I'm fine? Or is this going to be something that's kind of like the flu shot that's ongoing?
Yeah, that's a great question. And boy, I wish I knew the answer. I think we all wish we knew the answer. We just don't know at this point in time. I mean, right now, we do know that people who get COVID, there have been documented instances of them getting a second bout of COVID. And they've documented this by doing the typing out the mRNA or the RNA of the COVID vaccine the first time, and it's a slightly different from the second time.
Okay.
So the immunity is clearly not 100%. However, those people who seem to get it twice are the rarity. And I think we'll just have to wait and see. At this point, we don't have any predictions.
So we're basically saying we have to get the vaccine out and then see if people get it again. That's pretty much what we're going to be looking at.
Pretty much, yeah. And, you know, the people who are entered in the trial right now will get continued monitoring. And that'll give us a hint
Right.
of how effective it's going to be in the long term. But we won't know for like years. We won't know if this is going to be one and done, one in every 5 years, every year. We just don't know.
So on the vaccine front, do you know anything on the goal of getting it administered? I know emergency workers and so forth would be the first to get it, doctors, so forth, but do they have a time frame as far as when they would like the general public to have be available, or say that everyone in the general public is an opportunity by June, July? Do we know that?
We don't at this point in time. Certainly the vaccine companies are actually, they're doing a big risk. They're actually manufacturing it right now, even though it hasn't been approved yet. They will, once it's approved, they'll send a certain number of doses to the state, which will allow us to immunize key hospital workers and frontline, the EMS. But after that, it'll depend on how quickly it's manufactured and the demand across not just this nation, across the world. It will also depend on how many vaccines come on board. You know, if both Pfizer and Moderna come on board, then that's going to exponentially expand the amount of vaccine that's available, as opposed to if only Pfizer gets approved. So we just don't know at this point in time. We're planning for a lot of contingencies.
Airborne, obviously we talk about the masks, but is there a way that they can find out if, like, for example, on surface, for example, I'm a school teacher, so between periods we spray down desks and so forth, but how much of a concern is that on surface compared to airborne?
Airborne, yeah, another great question, and I don't know that we have the direct proportion of how many people are infected by aerosolization versus by touch and then and touch. There is a huge risk with aerosolization, and there's been a number of case reports where, for example, a restaurant, an individual sitting by an air conditioning vent, eating at a restaurant, and then all of the people downwind from that individual were infected by that individual. They could link it back. So clearly, all of those individuals, it was aerosolized to them because they didn't go to that table and touch anything that person had touched.
Right.
They just happened to be in the airstream. I don't know that I've seen the same data about how many people touched a contaminated surface and then ended up getting the disease.
It was just something that was curious. Yeah. And finally, have we seen you said we've seen lower death rates. Have we seen an increase or recovery time? In other words, recovery time is getting better. So maybe when it first came out, the recovery time was. Have we seen that improving? Like maybe it was recovery time was 5 or 6 days, or depending, and now it's gone down.
The last time I looked at the length of hospitalization, the average was about 9 or 10 days, and that didn't seem to be changing much at all. And again, that's an average. It might be shorter or longer. It's a curve.
No, I really appreciate it. So thank you for answering those. Mm-hmm. Thank you.
Sure.
This is Long.
Thank you, Mr. Chairman. On the vaccine, one of them is a two-part. Is the second one that's being approved one part?
No, I think both of those are two-part vaccines. So it's logistically really complicated. It's a very cold vaccine. It has to be kept
Both of them?
both of them, I believe, are very cold. They're both using a similar technology, and they're both two-part, but I think there's variation in the length of time. I will say that if there are multiple vaccines that we are responsible for, the logistics of making sure that if you start with one, you end with one, and that we keep them all at the right temperature is pretty challenging. We're up to it. We deal with vaccines every single day, but it will add just another.
We don't have many vaccines that we keep at 97 degrees below zero. Is going to be the challenge.
We do not. In fact, we are ordering freezers as we speak so that we can store those vaccines in the health department because we don't have a freezer that goes down that cold.
How long are they viable once they're taken out of storage?
So don't quote me exactly on this, but you can bring it down to a cooler frozen temperature, and then it's good for 5 or 6 days, and then you can mix it and bring it up closer to room temperature, and then it's a very short time. So I'm sorry, I don't have those exact numbers.
You won't have to transport.
No,
Super cold freezing.
no, we do not have to transport it at that temperature. That'll
help a little bit.
It will help a little bit. And I have to say, kudos to the drug companies. They've actually recognized that this is really challenging, and they've come up with storage containers that will keep it at the right temperatures using dry ice. So even if we can't procure freezers immediately, we can still keep it on hand.
Thank you. Mr. Forehand?
Yes, ma'am. Two quick questions. First, you'd mentioned something about what is your contact tracing data showing regarding, is it most people are getting the COVID through work activities or through social activities? What's the data showing on that?
So the data, even looking beyond this, the CDC just analyzed this pretty broadly, and the biggest place is gatherings. So people going indoors to places like bars or eating in crowded restaurants. And then the next would be the type of gathering where you are with a whole bunch of people that you know and you feel safe, but they're not really in your bubble. So a wedding, particularly once alcohol gets involved, people go with the very best intentions. And then they have, a drink or two or three, and pretty soon it's, hugging and dancing on the tables. And once you do that, then you're suddenly not 6 feet apart and you're not wearing your mask. Where we're not seeing it is we're not seeing huge outbreaks in schools. You can actually go and look, and there have been scattered ones, but for the most part, when people are in a school setting, they actually conform to all of the guidelines that we met. Schools are pretty good about monitoring kids as they come into the school setting and having them wear masks and having the desks set apart, decompressing by having hybrid schedules. So we're not seeing it there. I have seen outbreaks from soccer, kids playing soccer together. They sit close together on the benches. Or they ride in the same car together, and then one of them had a case and didn't know it, and pretty soon we have an outbreak going on. The funeral outbreak that I mentioned earlier is another classic one. Occasional workplace, particularly people who are working in either front-facing or, more commonly, people who are doing the right thing when they're out facing the public, but then they go and have lunch with their colleagues in the back, and they sit at the same table, and they take all their protective gear off, and pretty soon we have 4 people out with COVID because they infected each other.